right, so we have hit 30 folks who are in the room. So I appreciate everyone being here this Friday morning. Hopefully you've got some coffee and we can dive right into the topic. Welcome to this week's meeting of the Tacoma-Pierce County Coalition to End Homelessness. Let's kick off, Rosemary, if you would, with a welcome message and an invite for folks to introduce themselves.
Good morning, everyone. I so appreciate the opportunity to speak and say a couple of things to center us on our work today. This is February 4th, the end of the first week of Black History Month, the annual celebration in the United States. There'll be important education programs and celebrations and memorials that highlight accomplishments and acknowledge the effects of past racist behaviors. This year, Black History Month occurs as states and school districts promote and pass laws limiting what of this past can be taught. They reveal the truth of Faulkner's words that, quote, "The past is never dead, it's not even past." So what to do? We meet here every week, finding our way together to respond and to advocate for safe and secure shelter for those of any background who are, in effect, displaced persons. This work reveals the effects of the past that is not even past, of redlining, exclusive zoning, discriminatory mortgage lending practices, opportunity hoarding, segregation, surveillance, and criminalization. Some of the people living this past into the present perch near overpasses or in other precarious public spots, and in the absence of adequate housing are being swept away today, February 4th. We need a stronger and stronger response to this, what I would call unnatural emergency. We need more outrage and broader commitment. Langston Hughes' words ring true in this regard, and I offer them for our thought today, both as a diagnosis and a call to action. He says in his poem, Evil, "Looks like what drives me crazy don't have no effect on you, but I'm gonna keep on at it till it drives you crazy too." So welcome everyone to our open table, a shared space where we're gonna keep on at it. Let me just tell you a couple things. I see many new folks today, and so our Zoom rules and our rules of being together are, if you can put those in the chat, that would be great, Rob. And we ask that you mute yourself if you're not speaking, and then also put away your video if you're doing other things that might be distracting. We also ask you to use the raise hand feature on if you're able to do that, so Rob can keep track of who's trying to have an opportunity to speak. And we also encourage use of the chat for sharing information, asking questions, posting announcements. Engaging in side conversations is not seen as anything disrespectful of the group. We use this time for networking, and we want to encourage that. The chat can be saved, and we do save it, so encourage you to do that. In terms of our community norms, you can see them in the chat there. We really try to have the kind of conversation that does let all voices have an opportunity. So today I'll just mention a couple of them: to speak from our own experience, to make space and take space, to assume best intentions, and take responsibility for impact. So with that, what we'd like to do at this time is just have people unmute themselves in any order. I see some new folks, and just to say who you are and what, if you're with an organization or any group like that, so we know a little bit about how to contact you about whatever it might be. So just go ahead and do it.
I'll introduce myself. I'm Janine Provosic. I'm actually very involved in 350 Tacoma, the climate organization, and the Conversation, a social justice group. And I've just become more and more interested in what's being done for the homeless, and more concerned because it just seems to not be getting much better. So I'm just researching. I'm trying to find out all who's involved and how I might be able to, I'm not sure what my capacity is, but be able to maybe help or do something. I'm just having talked recently with a city council member who said Tacoma doesn't get much help from Pierce County and that they don't really have a clear plan. That sort of concerned me. There's not a clear model. So anyway,
Well, welcome,
I'm-
Janine. Look forward to
I'm here
having you
for-
with us.
Thank you.
Evelyn,
morning,
I see you
everyone.
have your hand up.
Hi, good morning. My name's Evelyn Lopez. I just started after conversations with people who listen to a podcast that I do called Crossing Division on Channel 253, started a group called Compassion Tacoma. The goal of the group, well, I would say we're very early days. We haven't had a organizing meeting. We have a meeting set up for February 9th, a Zoom, that will start our strategizing. But the group is, I hope, a place where people can bring ideas and have open discussions. And I hope that our focus will be on short-term and pragmatic opportunities that we can engage in to try to make situations better for our homeless neighbors and for our communities. And I'll be frank with you, partly this effort started in response to the Tacoma Safe Business Summit meeting. I was concerned that I didn't see as many people of color in that meeting or businesses that were outside of the downtown or west or north end of Tacoma. And so I felt that there was an opportunity for perhaps a larger grassroots effort. And that's what we're going to try, and we'll see what happens.
Well, thank you for coming, Evelyn. Look forward to working with you. Thanks very much. See, Liam, I think you were going to speak earlier.
Yeah, I was. My name's Liam. I'm the lead RA for Harbour Hope Centre. We run transitional housing for 18 to 21-year-olds who are homeless out here in Gig Harbour. And I just wanted to jump on and let you guys know we currently have one spare bed in our boys' house and one spare bed in our girls' house.
Thank you very much for your work, Liam. Look forward to talking with you more.
Let's see, I see Janet has her hand up and then Kathy. And Janet, you are muted.
Always unmuted. I'm just Kathy Orlando. Don't laugh at me. I'm just going to say I've met a few of you on another Zoom call, and I would just echo everything Evelyn Lopez said, and we're working together on this Compassion Tacoma. We don't know what it's going to be yet, but we hope to be able to support groups like yours, see what we could do to, make it better. So anyway, thank you.
Thanks, Janet. Good to see you here.
Thanks.
Good morning. My name's Kathy Orlando. I have to come clean and tell you I'm chair of the Pierce County Democrats. And so, yes, I do have a political leaning. Recently, there was a poll done by Northwest Progressive Institute, which ranked homelessness and housing and community safety as the top 3 priorities in the voters' minds in Pierce County. So we're jumping on that opportunity, and we are focusing our efforts on how to be more active in addressing these issues, bringing the electeds around to what's going on and the reality checks. Janet and I took a nice little field trip this week, when they were cleaning out the I-72nd and I location, visited with some of the, I'll call them the residents there, but they're no longer residents, I guess. So they've got to take back the narrative, take back the verbiage, and let's do something for our community members. Thanks.
Welcome, Kathy. Thank you. I think, Amy, were you next? I think.
I'm not sure the order. Hi,
All right.
I'm Amy Champion. I am the Chief Operations Officer at Pierce County Alliance, and I oversee the Recovery Navigator program at PCA, which serves west of Puyallup in Pierce County. So we're going to talk a little bit about that later. Thank you for inviting us.
Thank you and welcome. Andrew.
Hello, I am currently an intern at Comprehensive Life Resources. I'm an intern at the Homeless Outreach Program. I'm just kind of here to hop on and learn a bit more about what goes on behind the scenes regarding homelessness.
Thank you for coming, Andrew, and thank you for your work. Helena, not sure which.
Hi, I'm Helena, and I don't have a preference on how you say my first name. And I'm here with Serve the People, and I'm gonna be switching on and off with Wolf, who's also here, just to represent our group and come every other week.
Well, that's wonderful. Thanks, Helena, and appreciate your work very much. Brian.
Hi, I'm Brian. I'm out of Comprehensive Life Resources. I'm the Pierce County Administrator for the Central Diversion Funds, targeting as young as 12, at-risk young folks, and then the maximum age is 24. So right now we have about $3,000 cap per month until the end of the contract, which is June. So we're hoping that this gets replenished July 1, but we've been making tremendous strides with getting some young folks housed in the last few months. So, yep.
Well, great. That's good work, and I hope that you have success with that. Thank you for coming. Andrew.
Good morning. My name is Andrew Gelston, and I'm the site supervisor at the District Court Resource Center. I'll save a lot of the information about the Resource Center because I believe I'm on the schedule for next week for the spotlight. But you know, we're still assisting people, and here at the Resource Center, despite closed to walk-in services, we're doing takeout. So takeout for clothes, and also through our partnership with Eloise's Cooking Pot, we're providing some food for folks. So you know, give us a call. Give us a call if you're in need. We'll put bags together for you and get people some food and warm clothes, warm and clean clothes. Look forward to being part of this group from this point forward. Really
Welcome.
appreciate what you're doing.
Well, and we appreciate what you're doing as well. It's an important resource, so thank you.
Thank you.
Jake, did you want to say something?
Absolutely. My name is Jake Preston. I am with the West Pierce County Recovery Navigator Program as the program director. I work closely with Amy, who had already introduced herself, and I think we have the opportunity to introduce ourselves more today. So I'll hold off on that. Thank you.
Right. Welcome, Jake. This is wonderful. So many new folks. If there's anyone else who hasn't had a chance to say hello, just go ahead and unmute yourself and do so.
Hi, I wanted to say I'm Sunshine, and I am the CHAP navigator at Tacoma Community College. CHAP stands for College Housing Assistance Program. And I was at MDC a long time. Hi, Rob. And just love MDC too. And it's a pleasure to be here. Thank you so much. To say time and time again, I'm finding, you know, childcare, living wage, and home and housing, those three things are just all linked together. Lots of childcare issues. So yeah, it's really good to be here. Hi, everybody.
Hi, Sunshine, and thanks for your work. It's really important.
Thank you.
And
Hi, everyone.
Alfred, you have your hand up too. And
Yeah. Sorry.
Go ahead.
Well, let the lady go there.
Hi, everyone. I am Bridget, Executive Director of BIMA Services. Some familiar faces there. Good to see everyone. I think I'll have a little moment to kind of present a little later, so I'll wait for that. But good to see some of you, all of you really, but
Thanks, Bridget, and thanks for that wonderful event you just did. So we'll look forward to hearing from that.
Yeah.
Okay, Alfred.
Yeah, okay, I'll say hi.
Well, hi.
Actually, that's Alfred Kirk, Tacoma Tenants Organizing Committee.
Thank you very much. Well, good work.
All right.
Appreciate your interest and welcome to our group.
Yeah, this is not my first time, but you know.
But saying hello, that's great. Thank you, Alfred. All right, I think we've got most folks. If anyone else is here and wants to put your name in the chat with any contact information and what your interest is, people will be reading that and can make contact if that works out. So thank you all very much.
And thank you. I agree with others. It's great to see so many new faces in the room today. So thank you for joining us this morning. The next item on our agenda is our regular This Week on the Streets segment. And boy, is there a lot happening on the streets this week. It's been mentioned that the sweep of 72nd, East 72nd and I Street took place earlier in the week. And of course, the city notified us last week that today the sweep would begin under Highway 705 down along Puyallup Avenue. So that is happening right now. If you happen to be watching the news this morning, you probably saw live coverage from that, and I'll drop some links into the chat later with some of those stories. But this segment is set up to be an opportunity for those who do direct outreach and interactions with those on the streets to let us know what is changing, what are the needs that are changing, what can we do today to help those who are currently homeless. So I open the floor. Please use the raise hand function, wave your hand, whatever works. I see the first person with a hand up is Jeffrey.
Good morning. I've been over to the 72nd and I encampment several times in the last week. Most have been disappointed that they were told that there were no shelter space available for them. And except maybe congruent shelters, which bothers me because we're in the middle of a pandemic. I did see several heading west, all their gear packed up and heading west, and I saw a couple heading south. Don't know where they're going to go yet, but I'll keep an eye out for them. Thank you.
Thank you, Jeffrey. Wolf, you have your hand up.
Hey, y'all. So Serve the People did our usual over 100 meals this past week around encampments on the hilltop, as well as warm clothes, hand sanitizer, and some other supplies. We're also doing DIY clay pot tent heaters lately to help keep folks warm while it's very cold. As Rob mentioned, big sweep today at the 705. So, you know, people are going to be dispersing and there's going to be a lot more work to do. This is one of the biggest sweeps Tacoma proper has seen in quite a while. So it's definitely going to increase the number of people who are, you know, kind of just moving around, and definitely the number of people we're serving on the hilltop. We also served recently at the latest La Resistencia rally at the detention center. And, you know, where it's important to us to support other groups that are organizing in our community. If you'd like to support our work, and definitely there's going to be a lot of work to do with, you know, more folks around after the sweep, I'll put our donation information and contact information for any monetary or in-kind donations in the chat. Thanks so much, y'all.
Thank you, Wolf. Janine.
Yeah, because I'm so new to learning this, I had a question. When they do a major sweep like 705, which I don't know why they ever let it get that huge, but anyway, what do they do with all these people? I mean, do they have a plan when they sweep? I'm just learning this, and I'm kind of horrified that they just sweep and then what? Where do they go?
Yeah, that actually is a very astute question. It's the question of the day, really.
Yeah.
Typically, the city of Tacoma, I can't really speak for the city, and I know the city has an opportunity to do an update later in today's meeting, but typically they've worked with smaller sites, and they've only done sweeps when there are enough shelter spaces to match or exceed the number of people who are at a particular site. We have, as a coalition, we have a statement that we all agreed on back in October of last year, that sweeps are damaging to people, and that without adequate shelter resources that people will actually be able to use that match the people who are at a site, it's something that just does more harm for people, scatters people, makes it harder for people to be served. In the case of the 705 site, the city came in last week and said that it was due to public safety concerns with, in particular, fires that were taking place down at the site, that they decided they would do a 1-week notice and sweep that site. So the one week period ends today. The last update I heard from the city earlier in the week is that they will not be removing everybody from the site today, but the process begins today. And in fact, the cleanup, I think, actually started earlier in the week. So we're going to be talking more about this later in today's meeting. So you ask a very good question.
Thank you so much.
Yeah. Teresa?
So on that note, we struggle as a group to have people with lived experience be able to attend this group, particularly because it's Zoom, it's technology, it's when it is. But there are a lot of you who do have relationships. I have relationships with people here on my street. But I bring up this because Lionel Donovan of King 5 is trying to put out some information about the sweeps. And I think his intentions are good. I think he wants to inform the public about what's going on and the impacts it has. Logically, he's asked if there's anyone with lived experience who has been affected by sweeps who'd be willing to have a chat with him. I'm going to put his contact information. I think about people like Wolf and Jeffrey and others. I don't know if anyone from either of those two sweeps is going to land here in my neighborhood. It may be something that people are not interested in, but there might be someone, who would be able and willing to put that perspective out there in the public. So please facilitate that if you can, if you're interested in it. I don't think it's a symbolic move. I think it really is an attempt to have some other voices heard.
Thank you, Teresa. Richard, did you want to provide any kind of update during this section of the meeting?
See, I just arrived here, and yeah, I don't really have an update yet, but I would say that anybody on the call is welcome to come on down anytime today, take a look at what's going on. The sweep seems to be underway. Laurel's here, the hot team is here. I see garbage pickup going on. Actually, you can see garbage pickup going on. And so we're just down here to kind of see what is going on. Good morning, and this is Laurel, who is with the HEAL team in the city. And anyway, I'll check in on the call later. We just got here and are figuring out what's going on. Thank you.
Thank you, Richard.
Thank you.
And does anybody else have information they would like to add for this week on the streets? All right, so I do urge folks to use the chat. We are going to talk specifically about sweeps coming up very soon. Kathy, did you want to say something before we moved on?
Just input, Lionel Donovan is very interested in reporting what's going on. He introduced himself to me on Wednesday, the 26th at our rally, and he seems open to hearing from a lot of different stakeholders. So if anybody wants to make contact with him, please don't hesitate. He seems to be a lovely person.
Thank you for that. That reinforces Teresa's comments as well. So thank you. So again, please use the chat. This conversation will continue. We're going to do breakout conversations later in this hour to talk about what we should be doing, what possible actions we should all be taking as soon as we get out of this meeting to support folks who are out on the streets. So we will get to that shortly. The next item in our agenda, though, is I would like to invite Bridget Johnson from BIMA Services to do our community spotlight this week. Bridget, are you available to do that?
Yes. Hi, everybody again. Let me see if I can. Okay. So thank you for this opportunity. Good morning, everybody. I am Bridget. I am the founder and executive director of BIMA Services. BIMA stands for Believing in Myself Again. We are a restoration program serving the unhoused community, low-income community through community outreach and supportive housing. We believe that sustainability is one pathway, but you have to have a foundation and restoration in order to obtain sustainability. So we do that through the 7 pillars of restoration. So we address your medical and all the other things that go along with that. Some of the services that we offer, we do substance use assessments. We got approved by the state of Washington. So it's not fully ready to roll out yet, but we are approved and we'll be up and running, I'm hoping, this quarter. We also have the foundational community support contracts. So we're able to have housing navigators and employment navigators. And our main focus is we do supportive shared housing. And so we have about 5 houses, and we serve one of our houses. There's a re-entry house for Department of Corrections. We just opened a house for new pregnant moms, new moms, or new pregnant, first-time pregnant people. So you can either be pregnant or with one child under the age of 1. And then, of course, we have our men's housing and our women housing. We also do community outreach for the folks that we're not able to house. And as most of you know, we recently had a day of give, is what I call it, this past Saturday, where we passed out 300 blankets, hats, gloves, snack bags, PPE, all of the above. And so if anyone from CCS is on the line, we want to thank you for allowing us to use that parking lot. It was very, very helpful. We also served hot soup. And that's one of my favorite day of gives. We kind of do day of gives all year round, but that's my favorite. It really speaks to me, dealing with my own homelessness over 15 years ago. Don't know if some of you saw the video, but I remember being homeless and cold. Someone had stolen my coat and it was snowing, and I'm standing on the street, and I didn't know that I was on the bus stop. And the bus came, and I said, "Hey, I'm hungry, I'm cold, and I don't have any money." And he said, "Come on in." And he gave me his lunch, which is why we serve soup. And he said, "Go to the back of the bus," and he turned on the heat. And I rolled his route from one end of the county to the next. So it didn't solve my homelessness, right? But it did give me a moment of clarity, because change is an inside job that manifests itself outwardly. So I had an opportunity to have clarity to think, I've got to make different decisions and do something different. So I got connected to community resources, which is where our supportive housing, our substance use, and all these things, because we want to be the first and last place anybody can come to for help. I try very hard to bring services to the people instead of giving them referrals out to, because that's when we lose them and we lose the connection. So that's one of my very favorite day of gives. I think, oh, how do people get to us? So you can go online. You can fill out an application online, or you can print it and email it and fax it in. You have to be 25 years and older for all of our homes except for the pregnant home. The pregnant home, I think we started at 18 and we just raised it to 19 because we realized that's really where the homeless population lies with these new moms. We accept referrals from any and everywhere. But the catalyst is that we want you to be in readiness stage of change. You don't have to have the solution to your problems. You just have to be ready to fight. And because without that readiness is pretty difficult because it starts with the participant, right? What was the other one? Do we take referrals? Yep, that's it.
Thank you,
Are there
Bridget.
any questions?
Yeah, let me see if anybody raises their hand. I've seen lots of thumbs up and clapping.
Yeah.
All right, I'm not seeing any questions, but one thing that would be really helpful. Jan Runback asked, how many can you serve?
How many people can we serve? In which
Yeah.
program?
That's a great question. It would be
in all
great,
of your
Bridget,
programs.
if you could share your contact information and the website in the chat for people.
Oh, absolutely. I'll do that,
Yeah.
Rob. So with the substance use assessments, it's pretty much just endless because we're assessing them and moving them forward, right? So there's no cap. Same thing with the foundational community supports. As long as I have case managers, we've got room to provide that navigation for employment and housing. But in our housing, each house holds anywhere between 5 and 6 people. And so we have 5 houses. We are working on a 6th house because we have an overwhelming response to the pregnant women house. Yeah, so did that answer your question? Okay, so stay tuned for our next day. Again, we are working. Last year, we were able to serve 200 students with about 8 different schools, maybe 3 different school districts, school supplies. So we continue to, our 4 main days of gives are Christmas, which this past Christmas, we were able to serve a little over 200 children. So we had Christmas, our day of give, school supplies. We're working on doing turkeys and hams for Thanksgiving, and then of course our blanket. Those are our main giveaways. We try to sneak some stuff in between, but based upon our supplies.
Well, thank you so much, Bridget, for being here this morning and for all that you're doing in the community. And I think you're going to get lots of folks who would like to help support. So
very good. Thank you all.
Thank you. So if you have other questions for Bridget, please use the chat and we can make sure that those get passed along. Let's move to the next item on the agenda, which is a presentation regarding the Pierce County Recovery Navigator Program. So I'm not sure exactly who wants to start that. Amy, is that you?
That's me. That's me. I can't see if Tony is here from the east side, but I know Jake is here. So I'll give a brief overview of where the program came from and what it's about. And then I'm going to turn it over to our program directors to give you more details about operations and how to get in touch with us. So the Recovery Navigator Program is actually a statewide legislative directive, and it's in response to the 2021 ESB 5476, which was the legislature's response to the Supreme Court's ruling in Blake. That court decision essentially struck down the strict liability of drug possession as unconstitutional. So the legislature said, okay, but what do we do if people have drugs? We don't want to just decriminalize substances. And so they created this Recovery Navigator program, which requires law enforcement to provide referrals to substance abuse disorder treatment at least 3 times before they make an arrest and forward it for prosecution. There's a whole lot of back and forth about that, and are people actually ever going to be prosecuted? Whole lot of politics. I think the legislature is looking at some changes to that as we speak. But as it stands today, if somebody is found by law enforcement to be in possession, they have to be given a referral. So the Recovery Navigator program is where they refer people to. Recovery Navigators are meeting people where they are. It's a harm reduction model, which is relatively new for Pierce County. There's no requirement to enroll in treatment. There's no requirement to give a UA. We're there to help to figure out, what's it going to take to help you move along this behavior change model. Let's see. In addition to the law enforcement referrals, the program is also authorized to receive social referrals. So essentially that's anybody else. People can self-refer, moms can refer, doctors can refer, just anybody that you see that you think might benefit from some harm reduction around substance use, you can refer them. Under the legislation, again, there's no requirement for engagement with sobriety. So it's essentially a mechanism of early intervention as opposed to deferred prosecution, like drug courts. So we're trying to prevent people from winding up in the justice system just before they cross that threshold of some larger crime, intent to distribute, crimes related to trying to get drugs. Let's see, I have slides behind my screen, so give me a second just to look at my notes. I think it really represents a cultural shift toward responsiveness rather than reactivity and punishment, where we think of ourselves as hope and action, and we're seeking to reduce the adverse health and social economic consequences of legal and illegal psychoactive drugs. You don't have to be actively in addiction. It could be a history of addiction that might be triggered by something that's going on in your life, for example, homelessness. We're there to help people on their journey toward well-being and to stay out of the criminal justice system. So again, we accept referrals from law enforcement and social referrals. We meet people where they are literally and figuratively. The design of the program is to get us out of, office buildings and appointment scheduling and all of the formality of our systems. So we respond to referrals within 45 minutes if it's west of Puyallup. East of Puyallup is a more rural area, so the legislature gave a 90-minute response time, but we're right here in the heart of Tacoma. So we respond within 45 minutes of receiving that referral. Recovery Navigators meet people out in the community, and we offer acceptance and flexibility for how people need to engage with us. A main tenet of our program is to break barriers to access to care, whatever that care is. If it's needing a pair of shoes, or if it's needing SUD assessments and treatment, if it's even, getting into inpatient, if it's medical care, if it's mental health, education, we're there to knock on the doors. Hopefully what we've been focused on is establishing relationships with other service providers and systems so that we can provide warm handoffs. We're not just going to give people a piece of paper with a phone number. We're going to put them in the car, drive them there, make the introduction, sit and have a cup of coffee, case consult, give what we can to the person we're handing them to, and have that person bring them in. Let's see. We're working very hard on changing our language from that traditional sort of medical model, social service model of intake and referral. And so we say we listen and brainstorm. We're helping people prioritize. That's our biopsychosocial assessment, so that we're collecting a list of what their needs are. We're just listening and helping them figure out what's the first step here. We coach for change, intensive case management, and we clear pathways. So that's our warm handoff to general social services and treatments along the continuum of care. Again, Pierce County Alliance runs the Recovery Navigator program west of Puyallup, all up into the unincorporated areas across the bridge, past Gig Harbor into Key Peninsula. Jake, who's on the call, is our program director at PCA. He manages 6 recovery navigators. A couple of them are actually outreach coordinators, and they're working right now. Their focus is 100% on finding housing. I honestly, we've seen about 100 people come through, or at least call us. They may not be fully engaged in our case management portion, but we've seen about 100 people, and I think all of them have had a housing need. For Pierce County Alliance, we've also had a CBRA contract, which is the community-based or community behavioral health rental assistance through the Department of Commerce. We went through that money within months. But in that process, we saw the need to scope out how can we get people access to housing and access to rental subsidies. So we have a couple of navigators that are focused on sleuthing it and making those connections. On the east side, the program director is Tony Kagachi, and they have 2 recovery navigators, and our programs operate so completely differently because of the urban rural nature of the county and resources. So here's how you can help us. You can get to know us. Again, we have 6 navigators in Tacoma, or stationed in Tacoma, that go out. We accept our invitations to come and meet with us, and please invite us to what you're doing. Consider joining we have a policy coordinating group that sets the tone and the policy direction of our program. I think one of the first things they're going to consider is whether or not we should open up the Recovery Navigator program beyond SUD and include mental health. A high portion of the people we serve have co-occurring disorders. And then you can also consider joining our operational coordinating group, which is those more lower administrative levels that are closer to the grassroots, so that when we're trying to develop those warm handoffs, we have names with faces, and we can call and say, hey, how do we get into this system and have that relationship? You can make referrals. For Pierce County Alliance, we accept referrals 24/7, but we're not able to respond outside of business hours quite yet. Our ramp up is for July. We will be 24/7 and have that 45-minute turnaround 24/7. Right now, it's 45 minutes during business hours. And we have a hotline phone number that you can call. We have an online referral form that you can just hop online and submit it. You can walk in. In East Pierce County, you can call their hotline, and they are 24/7. And then give us feedback. If you see us out in the world and we're seeming a little off, let us know. It's been a pretty frantic ramp up. We got the funding in November, and here we are, February. We're fully operational, fully staffed, and serving people. So I'm going to go ahead and turn it to Jake to talk more about what the navigators are seeing and doing. Jake?
Wonderful, Amy. Thank you for the introduction. The couple things I'd just like to thank Amy for the information that was given out, very thorough. At ground level, the Recovery Navigator, some of the things that we are working on even building a team of certified peer counselors is changing language in how we use internally. We don't, for instance, we don't discharge people, we don't close people out, we put people on hold. It's completely voluntary. Whether or not and how they want to show up is completely up to an individual. And so some of the things that we have seen, the individuals that we have helped, as Amy said, by and large, a lot of it are coming to us very home insecure. We have been able to place people that have been fleeing domestic violence, people that have coming out of long-term treatment programs, out of institutions, and really the goal is to break down barriers at every level and in every way we can. Sometimes that's having a cup of coffee, meeting somebody where they're at, and not having them have to come into the office. That is the major focus of how we operate currently and how we're moving forward and operating. As Amy said, July 1st, we're looking at moving in this progressive implementation of the program to be able to take calls 24/7. I want to reiterate the nature of the program. While it is written as a diversion program, it is a pre-charge harm reduction program. And with that, it really gives us the latitude to open up to anybody who perceives themselves to have a problem, and really opens the doors to inclusion. That is the standard that it has been written, and those are the marching orders of how we're going to operate and how we operate. I guess I would, at the conclusion of this, unless Tony showed up, and it doesn't look like he has yet, I would hand it over. Thank you.
Thank you, Jake and Amy. I did see one question in the chat, actually a couple of them from Christine Lindquist. One is, how do you typically link clients with healthcare?
We have staff capability to help people sign up for whatever the services are that are missing, right? So getting covered under state insurance. We start making phone calls. We start knocking on doors. Healthcare is really challenging right now because of COVID. We can't go. So we're making phone calls and saying, hey, we've got somebody, we're bringing them to your door, and we're doing the best we can with, virtual and phone. Yeah. That's definitely, if people can help us strengthen those ties, it'd be appreciated. We are seeing multiple times we've had people discharged from emergency rooms or medical facilities, and they've just been put in an Uber and dropped off at the Pierce County Alliance door in the middle of the night. So I mean, that we don't like that. We'll go sit on the steps and bring them a cup of coffee or invite them in, but we have to know they're there, and we need that back and forth. So if anybody has any ideas on how to strengthen that process, especially during COVID, we'd sure appreciate it.
Great. And another question from Christine was about, how does the housing piece work? So you talked a lot about staff who are trying to locate housing resources. Anything further you could share there?
Sure. So as I mentioned, Pierce County Alliance also has CBRA money. So many of the people that we've enrolled in CBRA came to us through the Recovery Navigator program. So if we have something on site that we can do immediately, we plug people in. Our staff are also well versed in applying for all of the other housing subsidies. Aside from the money, we've been on the ground meeting with other housing providers. So we have a lot of foundational community support contractors that we know that we're connecting people with. We have been out meeting with landlords. We've been out meeting with supported housing providers so that we have those warm referrals. We work with a lot of the Oxford houses. So everything from reentry after incarceration to supported housing to clean and sober housing to private landlords where we're knocking on doors and building relationships. And, you know, I think we're having a pretty good success rate in getting people housed and matched to places that work well for them. So, I mean, we're chipping away. We're not a housing provider, except for that we are, because that's what our people need. Our expertise truly is SUD. So another place that we welcome your help and advice and input, because our expertise is SUD treatment. So we're bumbling around and doing the best we can. I think we're doing okay.
Well, and I'm seeing appreciation in the chat from folks for what you're doing, especially Teresa mentions anything that keeps people from having to enter the criminal justice system has her support. So I really appreciate the two of you being here this morning. It's too bad Tony couldn't join us, but maybe we can bring Tony back to talk about what's happening in the east part of the county later. And anything else you would want to add before we move on to other topics in our meeting this morning?
No, Jake?
Thank you for the opportunity to present.
Great. And yeah, any time that we can be of help, please let us know. Jake, I did notice that you dropped a phone number and contact form into the chat. If you would like to do that again so that folks can copy it down, that'd be great.
Absolutely.
And thanks again for being here.
Yeah, I'll just say one more thing. We do have the hotline phone number. The other is a link to an online form that has somewhere around 7 questions. It really just puts us in contact with the individual that's being referred or self-referring. So I will put those back in the chat. Thank you.
Great, thank you. All right, so let's shift to our breakout conversation for this morning. And, you know, I'm very cognizant that I've seen on the screen Richard periodically showing what he's seeing down under the 705 in the encampment area that's being swept this morning. And clearly, while we're here trying to do good work, there's people being displaced. And so we wanted to have a conversation in our breakout discussion for about 15 minutes this morning to talk about what could or should we be doing right now to stop sweeps from further hurting those who are homeless in our county. So I know it's a tough question, but I thought we'd create a space where folks could be in small groups and share their thoughts about what we should be doing. What we could be doing, and what we could be doing as soon as we leave this meeting if we have the capacity to do so. So I am going to drop everyone into and invite everyone to join a small group meeting, 5 or 6 people in each room. Please use the opportunity to introduce each other, get to know each other, and then discuss the topic. And if somebody could take notes and drop those notes in the chat when we return here, that would be fantastic. So let me create the rooms. Yeah, and as Richard says, come on down to 705 after the meeting. There is definitely value in being a witness and there to support those who are being displaced, even if we can't provide them a place right at this moment. So let me create the rooms and we will spend 15 minutes discussing today's topic. I will post the topic again once you have joined rooms. Welcome back, everybody. Hopefully that was a useful conversation. Everybody got to know each other a little bit and talk about this morning's topic. Great to see cameras on. Gerald, I see you on screen. That's cool.
No, I was like, why did I do that?
Good morning, everybody. Yeah, good morning. So a reminder, please, those who took notes in the breakout rooms, please post those notes into the chat. We do compile the information from each of these breakout conversations and try to make good use of the information to drive what work we do next. So So I really appreciate everybody participating and appreciate those notes being in the chat. We are a little bit behind on our schedule, which is not unusual. I wanted to shift now over to our regular government updates that we have every week and invite, I'm not sure if we have anybody from the city of Tacoma on the call this morning to give us an update. So create some space for the city of Tacoma if anybody's here. All right, I did not get a written update from city staff this week, but I do want to remind folks that the city is in the midst of hiring up in the community and neighborhood services department and should have someone assigned to attend these meetings very soon. Let's shift over to an update from Pierce County Human Services. Jeff, do you have an update for us?
I do, yes. Just a couple things real quickly. Our homeless point in time count is done. It was done last week on Thursday and Friday. Thanks to all of you on the call who participated. We're now in the process of going through that data that we've collected and getting rid of duplicates and just figuring out what our total number will be. And just so you know, we don't just count people who are unsheltered. This point in time count is a count of all who are unsheltered as well as all who are in emergency shelter, those who are sheltered in our programs that are in HMIS. We will be working with some folks who don't use HMIS. Teresa, I think of you first. And then if Bob or Chandra's on the call, I think of you second. Those are the folks who have reached out to us and let us know about programs that provide emergency shelter that don't use HMIS. If there are any other programs that provide emergency shelter, even if it's in hotel motels, if you could reach out to me and let me know. We want to make sure we're including all people in our sheltered count who are in programs that are here in Pierce County to make sure that we get all of those numbers correct. So if you want to reach out to me, that would be great. But I just want Teresa and the folks on the Peninsula Gig Harbor area over there to know that we haven't forgotten you. You're on the list. Secondly, we have a funding opportunity that was released a few weeks ago, just to remind folks. It's the Homeless Housing Program funding opportunity. It's open. Those dollars fund emergency shelter, rapid rehousing, permanent support housing. All of the interventions that we do are eligible under that funding opportunity. It closes next Friday, February 11th. So if you're looking to apply, I would encourage you to start now or have started weeks ago. But it's not too late. It just may take you a lot of time between now and next Friday to submit it. A lot of work, I mean, to make it happen, but it's doable. And then the last thing I want to share is that we have finally, after some time, several years, published our homeless housing program policies and operations manual. That's the program that the bulk of our funds, except our continuum of care funds, are included in. We've been trying to release this, but COVID has really shifted our priorities over the last 2 years of what we do and how we do it. But we're excited to let everyone know that our program policies and procedures, the basic operating manual of the work that we do is available. You can find it if you're interested online at our Human Services website under homeless programs, under plans. Staff asked me to just share that because they're excited it's out there and they want people to use it and look at it now that it's finalized. That's it.
All right, thank you, Jeff. And thank you for the work you did on the point in time count. We look forward to seeing the numbers as they come together. And let's see, so I don't see Valerie in the room this morning. I imagine she's off at another meeting regarding rental assistance and the rental assistance program. Anything that you would want to add on that, Lori? I saw you were still here.
Yeah, as far as I know, the rental assistance portal is not up as yet. It's supposed to be up today. That's what I've been told. I think she's not here because they're in the actual process of making that happen. So fingers crossed, looking forward to it. All of our attorneys just got access to the portal when it does open. So that's a huge thing, because then we'll be, as we help people, we'll be able to look up where they are with rental assistance. Just with the delays, it's been really tough. So, and we're out at Key Peninsula this afternoon, rental assistance and Tacoma Pro Bono Housing Justice Project.
Great, thanks, Lori, and thanks for the work you're doing along with Valerie on that. Let's see, do we have an update from the Tacoma Pierce County Health Department?
Hello.
Hello.
Jenny, good morning. Hi, Rob. Hello, everyone. Before I launch into sort of my regular updates, just want to take the opportunity, since we all were discussing in the breakout groups about sweeps, that I put in the chat, but if you need if outreach teams need PPE or masks, please reach out to me or my colleague Rachel Hauser. I'll drop our information in the chat, and just would say too, in general, moving forward, I mean, we've been involved in a few of the sweeps in the fall. We did vaccine outreach and things like that, but Rachel and I are going to meet also. Thanks, Rob. We're going to meet also and just sort of talk about a more concerted effort of the department and how we want the outreach teams to do what they do, because they're amazing in doing all this on the ground work, but we want to kind of brainstorm how we could plug in and be more supportive. And so if folks have feedback on that, I can't promise we can fulfill everything that people ask us to do, but I would really like to hear from folks about how you'd like to see the health department show up. Okay, so that's my plug for the sweeps information. Just some data and news. We've got Moderna got full authorization, not just emergency use authorization. So from a vaccine standpoint, that is great news for COVID-19. Hopefully that encourages folks. Vaccines are coming for the littles, 6 months to 4 years. There's a request from Pfizer to the FDA to move forward on that. So we will see that probably in the coming month, I would guess. Our latest data are showing that unvaccinated people are way more likely, this can't be overstated, way more likely to suffer COVID-19 outcomes. So 3 times more likely if you're unvaccinated than vaccinated to be infected, 10 times more likely to be hospitalized, and 9 times more likely to die. So while we've seen our cases decrease, we've kind of been at our peak and we're going down, there is still a lot of work to be done. Thank you, Kathy. Happily vaxxed and boosted. I'm going to share information in the chat, as I always do, about where you can find your vaccine. And to put a plug in for boosters, if you've got your primary series and your booster, that's called up to date. We call having your primary series just fully vaccinated. That's still considered fully vaccinated, but the data are showing that the booster is really, really key. It really, truly boosts immunity. So don't wait on that. Please get your booster if you are still due. We do have a new Omicron variant, but the vaccines are showing great effectiveness against that. So I will drop some testing information in the chat, not only where you can find at-home tests, but how you can help folks to find testing. I know it's been really challenging. You can always reach out to us if you have needs at your particular organization to work with our testing team to potentially help support you on site. Otherwise, we've got lots of resources and it is getting easier to get tested. There are more opportunities for walk-up versus appointment type testing. So I know that the folks you work with, that's very important. What else? I mentioned PPE. So if you are an organization that would like to get your hands on some KN95s, which are those really nice masks, we have some limited resources and can help connect you. So please reach out to myself or Rachel. And just a quick reminder that it is flu season, and our flu season hasn't been as bad as in the past, but we did have our first death here in Pierce County from the flu, and we want to remind folks to get vaccinated for flu. So I will drop several resources in the chat. again, reach out to me or Rachel if you have thoughts about how the department can be more involved or more supportive before sweeps. And also always feel free to reach out to Rob and make suggestions of how our department can show up differently for this meeting in particular. I work in communicable disease, and COVID's been on everyone's mind for the last 2 years. So now that, that's been my focus, but we're happy to bring in others from the department to talk about other things. Thanks a lot.
Thank you, Jenny, as always, and great to see you this morning. Next on our list of government updates, I don't know if we have anybody from Pierce County Emergency Management here. I didn't see Ivan. So they may not have been able to send anybody to join us this morning, which is okay. So let's move on to the next item on our agenda for this morning, and that is a short advocacy update. Maureen was not able to join us this morning, so I will be a poor substitute. And what I will share is a couple of things. The state legislature is now more than a third of the way through the current short session in Olympia. I will paste some information about an action alert that from the Washington Low Income Housing Alliance, and remind folks that the coalition did adopt the legislative priorities of the alliance late last year, prior to the start of the session. This action alert is encouraging the legislators and the governor to include funding for housing and tenant protections and rental assistance in the budget that is being created right now by the legislators. I also wanted to share that the ongoing series of City of Tacoma meetings of the Tacoma City Council's Community Vitality and Safety Committee will resume with its next meeting next Thursday on Zoom at 4:30 p.m. That committee is still working on the various options that the city believes it has regarding creating some sort of ban on public camping. At least that's what they've been talking about. There has not been yet especially with a new council in place, a decision whether that legislation is going to move forward. But that committee was asked to investigate what other communities are doing. And at their last meeting, they actually discussed what various communities around the state are doing related to camping bans. The agenda for this upcoming Thursday meeting is not posted yet, so I do not have, I can't guarantee that this is going to be a topic at the Thursday meeting. However, it has been an ongoing topic since November. So Kathy, I see you have your hand up. You have a question?
No, I just wanted to say that I've been participating in the CVS meetings. And right now, I just really appreciate the Deputy Mayor, Catherine Ushka's approach, her guarded approach. She's listening to all the stakeholders. And I feel like she's doing a thorough job, and I've lent my voice to why I oppose it, because I don't think that criminalizing homelessness is in any way any kind of valid solution to the problem. I've also taken part in this week's advocacy days, and I know that Alfred Kirk was also there. We had some great lawmaker meetings. There's a lot of things. So if you get the Washington Housing Alliance, if you get their action updates, just follow them. Whatever they ask, just follow them. I cannot believe how baffling it is to try and keep track of all of these laws and where they're at and what people are trying to do with them. It's so whatever they ask, I will do it. You know,
Yeah.
if you want to make sure that people get a fair shake and they have an opportunity to respond to the rent increases that are displacing a lot of folks, then go in and lend your support to HB 1904, because that's going to give tenants an opportunity to respond to these notices. And if they have economic opportunities somewhere else, it's going to release them from their lease and allow them to relocate and pursue those opportunities. So that's why I support 1904.
Thank you, Kathy, and it's great. You're offering great advice to just follow what the Low Income Housing Alliance is doing. They do a great job. Michelle does a great job setting that up, and all the staff make it very simple to go in and sign pro or con, depending on the issue that's being discussed. Janine,
And thank you
have your
for
hand
bringing up
and
her name, because she's the one who asked me to say that in this meeting
great,
today.
Great. Janine and then Sally.
Yeah, just a quick question. That meeting next Thursday, how do I access that? I didn't hear the whole name of the committee.
So it is on Zoom. It's listed on the city's agenda page. I'll post, when I get done blabbering here, I'll post the link to that page in the chat. But
Okay,
as I said, they don't have the agenda posted yet for the meeting. It probably won't post till either later today or Monday. But
Okay.
but you can always confirm what the agenda is before popping into the meeting on Zoom.
Okay, great. Thank you.
Yeah. Sally?
Actually, they usually don't post the agendas until Wednesday. But in the city manager's weekly report, she indicates there are 2 items on the February 10th CVS agenda. One is the schedule for the CVS committee to address the camping ban options and a stakeholder engagement plan. And the other is a report from the city manager on the alternative response divertible calls initiative, which has dragged its feet. So that feels to me like a very consequential meeting, and anybody who has an interest in either of those 2 topics might want to be on that meeting.
Thank you for that, Sally. That's great. So let's see, additional updates for advocacy. So thank you again to Sally for, she listened in live to the Pierce County Council's Human Services Committee meeting earlier this week. They, during that meeting, talked both about affordable housing and about the comprehensive plan to end homelessness. And Garrett posted the link to that comprehensive plan earlier. What I will share is that the full council is going to be hearing more about that comprehensive plan to end homelessness in the coming weeks. The Human Services Committee is scheduled to have more conversation about the comprehensive plan at their February 15th meeting. I believe that's at 9:30 in the morning. I'll post the link to the Pierce County Council website in the chat. Garrett also tells me that either on February 22nd or on March 1st, the full county council is scheduled to consider the full plan for adoption, as well as for funding priorities for initial activities that would take place under the plan. Funding priorities that were actually set aside by Garrett himself. So I know Garrett told me if we have concerns about those, we can blame him. So accountability. So let me post the link to that in the chat. I will also post in the chat a couple of King 5 stories about homelessness. One about that was posted this morning about the sweep at the 705 encampment. One that was posted yesterday about Governor Inslee pushing a bill that would regard encampment cleanup and services along DOT right-of-ways across the state. And then I wanted to share this link and urge folks to give it a read. The CEO of the King County Regional Homeless Authority, Mark Dones, testified to a congressional subcommittee yesterday. regarding the steps that he believed are effective to address homelessness. And it's a really well-written piece. So that link is in the chat there. The written version of what his testimony or their testimony was before the congressional subcommittee. It's well worth reading, especially take a look at what Mark says regarding steps that he thinks are effective or that they think are effective, and compare those to the work that was done to create the comprehensive plan to end homelessness here in Pierce County. See how those match up. So that is, well, there's one other item I wanted to mention. Patricia, who has been is still in the call, mentioned House Bill 2075, which is a bill that would require the DSHS to reopen offices that are not currently accessible except by phone. That bill is another one to pay attention to down in Olympia, and I will post the link to the legislative page again so that folks can look up these bills and participate as items come up. So any other questions regarding the legislative session or advocacy? Janine, I see your hand up. Did you have another question? Oh, okay. Anybody else? All right. So let's shift to the next item on our agenda, and that is a update from the Safe Sites for All Committee. So Jan, I know you weren't at the meeting on Monday. Jeffrey or anybody else from the committee want to offer anything?
I do have an agenda, and I hope folks who are there, because we've got some hot issues that we need support on. Actually, right now we're dealing with 3 different areas, all demanding a lot of attention. One is the original safe parking network. The county is agreeing to continue the success of the pilot program. Paula Anderson is absolutely essential and critical and angelic in the work that she does as far as extending the reach of safe parking network. So we need to be there to support Paula and our already very engaged, very successful sites that offer safe parking for folks who enter the system. The other issue is that it's sort of fallen on us to talk about how best to have messaging on the encampment bans. So laws that talk about banning encampments, that is definitely a safe sites for all issue. It's not safe to go in and sweep, right? Just categorically sweep. So we're talking about how to perhaps better engage our other committee, which is the Safe Sites for All media campaign, get better messaging out there so that we as a coalition, if we choose, can have perhaps a stronger presence in the overall discussion on banning encampments. I mean, don't we know that when we had a constitutional amendment to ban drinking in the 1920s, that it worked really well? For heaven's sakes, let's keep on banning and banning. So that's the second thing. The third thing is we've taken on the project of having sites throughout the county. Typically they'd be churches or other like-minded sites that would agree to be staging areas for the future weather disaster. I hate to tell you, but climate change is happening now, and it seems that those who are the most vulnerable are the least protected. We went through a lot of effort and sweat to get supplies out to those who are houseless. Thanks to this coalition, I'm looking at Gerald, I'm looking at everybody. Thanks to this coalition, I think we were able to save not only lives, but morbidity. We were able to save toes and noses and ears and kidneys. We just don't hear about that, but that's a greater impact than just death, right? Sorry. So we're talking about getting a network of locations throughout the county with communication that, as if you are either a formal or an informal outreach worker. You know, we've got Jeffrey Boyce is like the king of that kind of an effort. We go out and we get stuff and we take stuff out, and we've got the trusted relation with the folks living in encampments already. So all three areas need support. See you Monday at noon. Go to the website for the Zoom address. What did I miss from Monday's meeting?
Think
It's
you've
almost
covered
as if
most
you
of
were
it.
there. Well done.
Nicely done. Nicely done.
And good to have you back, Jen. Hope it was a good break. So next on our agenda is an update from any coalition committee updates. Rosemary?
I just have a quick announcement. The Race and Equity Committee met and finalized the flyer that we're going to be using for outreach to other communities that we need to get introduced to and that we hope to share resources with. That will be available soon for everybody at the coalition to use and to give us feedback about it. If it helps to introduce our coalition to groups you are knowing about or involved with, that will be great. If something extra could help make it clear what we do or what is possible, then we'll change it. That's one of the nice things about having someone like Lori Davenport, who is willing to work on all these kinds of flyers to help us communicate who we are. So we're going to meet again as a committee on Thursday, the 17th from 3 to 4. That will be listed on the coalition page as something anyone can join if you're interested in talking with us about those issues. So that's it for that right now.
Thanks, Rosemary. Any other committee updates that we need to share? I'm not aware of any, but. All right. So now we've come to the part of the meeting where I just open the floor, items that would be good to share with everybody here. This is kind of our good trouble section of the meeting. So Jan, I see your hand up.
Is Clinton Brink still here in the meeting? He got some really good press with the MBA and Habitat for Humanity. Clinton, give us your good news.
I have good news.
Didn't you do Habitat for Humanity successful project in Fernhill?
Yeah, well, yeah, the master builders, we've been working on that house for the last few months. And I was out there, I don't know, a week and a half ago, maybe, doing a work day. It's coming along well.
There was a lot of positive news coverage about the homes there in Fernhill being permanently affordable going forward. So if you get an opportunity to read the article, it was covered in the News Tribune, and also I think King 5 did a story over the last week as well.
Yeah, I met the reporter, but I haven't had the opportunity to read the article yet. But I was out there with Derek Kilmer.
Fantastic. Anyone else with some just good of the order announcements that they'd like to share with the larger group? I'm the king of awkward silence, so you'd be surprised how long I could sit here. Lori.
Yeah, just a quick note. We are now, our Housing Justice Project, our help team is every Thursday we are at Lakewood City Hall. So if you're a Lakewood resident, you have any kind of landlord-tenant issue, not just eviction, anything going on, something on your record you need to take care of. If you're in Lakewood, come to Lakewood City Hall Thursday morning, 9 to 12.
Thanks, Lori. And Amy, thanks again for being here and for sharing that information again in the chat. One thing I'll remind folks of is we did have a number of new people in today's meeting, so I want to provide the link in the chat to the coalition's website and urge folks who are looking for resources, looking to see what the best estimate is of the current shelter spaces that are available, all of those kinds of things, as well as upcoming meetings of the coalition on the pchomeless.org website. If you do get an opportunity to spend a little time digging around that site, it'd be, I think it'd be worth your time. We also provide links and links to transcripts from previous meetings, video links to previous meetings. I saw Garrett cringe because he always is the one that has to, that does the maintenance and updating of those links. So can't say enough about the work Garrett does. But please do use the pchomeless.org site. It can be a good resource to quickly look up if it looks like there are shelter spaces available, if you've got someone you're working directly with. Anybody else with good of the order items?
Just along
Joe?
those same lines, just to say, we don't have closed meetings. So if you're new to the group and you want to come and just sit in on a meeting to see what's happening, to see if you're repelled or enticed into the meeting, come on down. You're always welcome.
And we definitely don't want you to feel repelled. I did want to ask Joe, where are we at with, where are you at with Aspen Court in terms of availability of space now?
So I have 2 rooms for Lakewood. Other than that, we are full. All the rooms are full. We just have 2 rooms for Lakewood. And you know, that's kind of where we're at. And so we had, like, since we've been here, we've only had 2 people leave the program. 1 person transitioned into permanent housing and 1 person transitioned out. Unfortunately, we didn't get the whereabouts. You know, so, and you know, and with the program, I'm thinking that we won't lose a lot of people in the program. It's a really good setting. You know, it's a real comfortable setting. So I don't think a lot of individuals will leave. You know, and through, like, working through the tiny homes is a little bit different because some people are kind of uncomfortable and they've left the program, or they didn't think the program was what they wanted it to be. But I think this being like a hotel setting, it's like, it's still comfortable because there's less congregational. A lot of individuals want to kind of keep to themselves sometimes, you know, especially if they've had trust issues, if they're chronically homeless, and they kind of just, you know, I've had a lot of problems out there. They kind of put them in that position. So, so I don't think we're going to have as many individuals leave this program for comfort reasons anyway. You know, but things are going good here, though. I can give you, like, some updated information, some of the main things going on if nobody else is going to talk, but I'll just sit back for a minute. If anyone else got anything, if you don't, I'll give you some more information.
All right, really appreciate that. And Joe, it's great that Lehigh has been able to fill the space at the converted hotel so quickly. So congratulations to you guys and for all your work personally. Anybody else with updates? All right, so I don't mean to artificially extend the meeting. It's always great to get some time back. I do want to relay, Richard left the meeting, but he was pretty clear while before he left, encouraging folks, if they do have an interest in being a witness to what's happening down under 705 today, that it is a good opportunity to see what a sweep looks like. So there's that opening if folks have the interest in going down to see Richard and support folks who are being displaced down under 705 today. And the last item on our agenda is just a reflection on today's meeting. Does anybody want to share anything about what they thought went well? What were we missing today? What should we include in next week's meeting? Jan.
We mentioned the website a couple of times. What goes really well is in between these Friday meetings, and anybody on the listserv, there was a request for assistance for a victim of domestic violence. It went out to everybody. I'm trusting that particular request got an answer, but I know when it comes to healthcare questions, I typically answer if I can, any other resources. So I think what's going really well is our listserv and the use of our website. And I'd like to give a shout out to that.
Appreciate that, Jan. Paula?
Yeah, one of the things that I think is really amazing about this group is the fact that when we do the breakouts, when we come together on issues, we all talk about the same things. It's like we all know what needs to be done, or you know, how people need to be helped and everything. One of the things that's bugging me now that I didn't mention it in the breakout, so I'm just going to mention it now, is I have had a long history of trying to communicate with the city that I work in about collaborating and putting on the city website that is pretty well used by the community, information about homelessness and a regular monthly story, something like that. So then I started thinking about this and I thought, well, what if the Homeless Coalition could work with the county, and the county somehow is able to convince cities in the area to post a story that is the same throughout the county. So just getting the information, the communication to the community. Everybody is afraid. People that don't know anything about homelessness, they're in fear of somebody sleeping in their vehicle, or they don't know how to approach somebody with mental illness, or why they're out there, why somebody who looks like they can work is not working, you know, all of these things. I just feel like we need to partner as a county with getting this communication out and doing that. So I just feel like I had to throw that out, just because that's the biggest thing, is that people just don't know. And maybe it would make things go a little bit smoother. Maybe people would be a little bit more tolerant if they had some background, and if those stories that we all hear as boots on the ground get out to the community. So somehow we've got to do that.
Yeah, that's a great thing to bring up, Paula. Thank you. And Jeffrey.
I'm actually very excited about today's meeting and the fact that we had so many new voices. And it's all our voices that make a difference. It's not just one or two. It's all our voices that make a difference. Be a good advocate with city council, county council, and the state. That's how we make changes. We make the changes at the government levels. And being a good advocate means paying attention to those two, not just how everyone's sleeping tonight.
Yeah, thank you, Jeffrey. And I think that's a great note to close on today. Really appreciate everybody being here today. And I do offer, if you have the capacity to hang on and help us plan next week's meeting, we will do that here shortly after taking about a 5-minute break. For everybody else, I hope you have a good, safe weekend. Stay warm if you can, help folks on the streets, and we'll see you all again next week.